Good morning, everyone, and thank you so much for joining the 2023 NFID Annual News Conference on Preventing Disease this fall and winter. My name is Patsy Stinchfield. I'm a pediatric nurse practitioner and the president of the National Foundation for Infectious Diseases, or NFID. This year, NFID proudly celebrates our 50th anniversary. Since 1973, the NFID has been educating and engaging the public, communities, and healthcare professionals about infectious diseases across the lifespan. As part of our mission, we have been hosting this news conference for more than 25 years. And each year, this news conference serves as an important kickoff for the respiratory season to discuss the latest information available and reinforce the importance of annual vaccination as our best prevention. This season is more complex than ever, as in addition to influenza or flu and COVID-19, we also have respiratory syncytial, pronounced like initial, respiratory syncytial virus or RSV is also circulating. So flu, COVID-19, and RSV can all be serious, causing a range from mild to severe symptoms. And we don't know who will get those severe symptoms. Potentially life-threatening complications can occur, hospitalization, and death. And this happens even in healthy children and adults. Many people who are hospitalized with these diseases have no underlying condition. So all of us need to pay attention to what we're going to learn today. The good news is, for the first time, we also have vaccines available to help protect against these three viruses responsible for the most hospitalizations in the United States. This is a thrilling year for those of us who work in the vaccine business and look at prevention of diseases. This is a year we have all been waiting for. So it's an important year to get the messages out. For those of you following along on social media, you can join the conversation by using the hashtags #GetVaccinated, #FightFlu, and #PreventRSV. Before we get into the discussion, I would like to share some highlights from a new NFID national survey of U.S. adults about vaccine preventable diseases. The data show that many U.S. adults are underestimating the seriousness of flu, COVID-19, and RSV, and they do not plan to get vaccinated. In fact, fewer than 1 in 4 U.S. adults are worried about themselves or someone in their family getting infected with flu, just 22%, and just 23% for COVID-19, and even less for RSV at 19%, and 22% for pneumonia. But there is some good news. We are pleased to see that most US adults, 65%, agree that annual flu vaccination is the best preventative measure against flu-related hospitalizations and death. Again, the majority of people agree that flu vaccination will help prevent hospitalizations and death. Unfortunately, only 43% say they will plan or they're unsure about getting a flu vaccine this year. So knowledge is one thing, behavior is another. We really need to make sure that our behavior catches up with what we know to be the best thing to do, and that's to get vaccinated. And more than 1 in 4, 28% of US adults who are at higher risk for flu-related complications said they were not planning to get vaccinated this season. To us in this business, that is worrisome. And sadly, we're also seeing low levels of intent for COVID-19 and RSV vaccination as well. Only 40% of US adults plan to get an updated COVID-19 vaccine. And the survey also found that among adults 60 years and older for whom RSV vaccination is currently recommended, only 40% plan to get an RSV vaccine. We have work to do. Among those who do not plan to get a flu, COVID-19, or RSV vaccine, the top reasons cited include concerns about potential side effects from the vaccines or a general distrust of vaccines. One thing this tells us is that there continues to be significant mis and disinformation about vaccines and a greater need for education and awareness. We know that vaccines are safe and they help prevent serious illness. For more than 50 years, hundreds of millions of people in the US have safely received flu vaccines, and millions of COVID-19 vaccine doses have been given around the world. Serious adverse events are rare. While vaccine effectiveness can vary from season to season, even in cases when vaccination does not prevent infection completely, it can reduce the duration and the severity of illness and can prevent serious complications, including hospitalization and death. So, this is good for businesses to vaccinate your employees and get them back to work faster. Even if they do get sick, they won't be as sick as long. So, potential side effects associated with vaccines are uncommon and much less severe than the diseases they prevent. The most important message you will hear today is this: getting vaccinated is the most effective way to prevent respiratory diseases and related complications. Everyone aged 6 months and older should get an annual flu vaccine and an updated COVID-19 vaccine. I got both of mine yesterday, one in each arm. I feel fine. I slept like a baby. Older adults, those with chronic health conditions, pregnant women, and parents of young children should talk with healthcare professionals about RSV prevention and pneumococcal vaccinations. Safe and effective vaccines are available in the US to help protect against flu, COVID-19, RSV, and pneumococcal disease. Getting vaccinated is critical to help protect yourself, your loved ones, and your community. So now I am thrilled to moderate the discussion with our esteemed experts today, including Dr. Mandy Cohen, Director of the Centers for Disease Control and Prevention, Dr. Bob Hopkins, the NFID Medical Director, Dr. Keith Ferdinand, Professor of Medicine and Cardiology at the Tulane University School of Medicine, NFID spokesperson, Dr. Bill Schaffner, and Dr. Vivien Dugan, PhD, the CDC Influenza Division Director, who will be here helping us with all of our technical questions. So following our discussion, we will be taking questions from the media only. Journalists can submit questions at any time in the box below the webcast video on your screen, but all questions will be held until the end of the panel discussion. So I am pleased to now welcome all of our panelists, and each of them will briefly introduce themselves. So Dr. Cohen, let's start with you.
Sure. Well, good morning, everyone. Thanks for having us here today. I'm Dr. Mandy Cohen. I'm the director of the Centers for Disease Control and Prevention, and I'm excited to talk about our work across all three viruses, flu, COVID, and RSV, and the vaccinations we can get to protect ourselves.
Great. Thank you. It's wonderful having you, and congratulations on your new position.
Thank you.
Dr. Hopkins.
Well, good morning. I'm Bob Hopkins. I'm the medical director for the National Foundation for Infectious Diseases. I'm also professor of internal medicine and pediatrics at the University of Arkansas for Medical Sciences and continue to see adults and children in our clinics. I've been doing clinical vaccinology for the entirety of my career, well over 30 years. And I can't emphasize enough how we need to get more vaccine into our young people, into our adults, and particularly into our pregnant women for the dual benefits of protecting babies and their mothers. And I think we all need to recognize that these vaccines are important. And what Patsy experienced is also a critical point. You can get multiple vaccines at the same time safely and effectively, and that may save you time in doing the other things you have to do in your lives. So thank you. I'm glad to be here and look forward to a great discussion.
Thank you, Bob, and congratulations to you on your new medical director role as well. And Dr. Ferdinand.
I'm Dr. Keith C. Ferdinand. I'm a cardiologist and professor of medicine at the Tulane University School of Medicine in New Orleans, Louisiana. Now, cardiologist is first trained in internal medicine, and we know that the same patients that I see with heart disease, lung disease, chronic kidney disease, and diabetes as a cardiologist are the patients who are hospitalized, get sick, and die with various forms of respiratory viruses, including COVID, flu, and RSV. Another thing I am is a community advocate, and for years, we've been going out doing cardiovascular screening, but for the last several years, we've been participating in flu vaccines. We have something called Flu NOLA in New Orleans. We go to community centers. We drive people to their primary care clinicians and to pharmacists in order to get their flu vaccine. We're also interested in disparities, and hopefully we'll have some questions related to that, specifically African Americans and persons who self-identify as Hispanic tend to get sicker, but have less vaccination rates.
Dr. Ferdinand, it's great having you. Thanks so much. All right. And the person who needs no introduction, Dr. Schaffner.
Thank you, Patsy. This is Bill Schaffner. I'm a professor of preventive medicine and infectious diseases at the Vanderbilt University School of Medicine in Nashville and a spokesperson for the NFID. As many of you know, I have been a supporter, promoter of vaccines for many, many years. This year, we have an extraordinary opportunity. Each year, we are faced with an outbreak of respiratory infectious diseases that occur during our winter season. We have now influenza vaccine, COVID vaccine, and for people aged 60 and older, RSV vaccine, which can be used to prevent the most serious complications of all of these diseases. These vaccines, they may not be perfect in being able to prevent absolutely every infection with these illnesses, but they turn a wild infection into a milder one. They keep us out of the hospital. My simple equation goes as this: disease bad, vaccines good. Let's get ourselves vaccinated this coming season.
Great. Thanks so much, Bill. Great to have you. And Dr. Dugan.
Good morning. I'm Vivien Dugan. I am the director of the Influenza Division at the Centers for Disease Control and Prevention, and very happy to be with you all today.
Great. Thank you. And I can just say, as a pediatric nurse practitioner in infectious disease and immunology at Children's Hospital in Minnesota, and my total career, 44 years of flu, RSV, and recently COVID, the reason all of us are on and doing this work is because in our careers, we have seen terrible outcomes from these diseases. We have all seen people, including young children, die of these diseases, and we know they're preventable. And it's like wearing a seatbelt. It may not save your life, but it will certainly increase your odds of saving your life. So it's the preventive thing to do. And so let's just jump right in with our discussion here. I thank you all for your introductions and your wisdom, and we will get more coming up here. We're going to begin the discussion by addressing some of the data and trends we are seeing and what it all means for this upcoming season. So Dr. Cohen, I'm going to start with you. And based on what we now know about the 2022 and 2023 season, and thank you all to your influenza team there who keeps us posted on all those beautiful maps and data, what should we expect for the upcoming 2023 and 2024 season?
Great. Well, thanks, Patsy, again. And this is a great and really important event. You know, based on what we are seeing from last year, we're preparing for this season to see COVID, flu, and RSV circulating. So we've known for many years we've had flu and RSV, but then now we're adding COVID on top. Unfortunately, these viruses are still here with us and are still causing real problems. But as everyone's been saying, for the first time in history, we have vaccines against all three of these major viruses that can protect us from serious illness, hospitalization, and death. So we are going to go into each of those viruses and what we saw last season and what that means really going forward. But this is really historic that we have this new RSV vaccine to protect our babies and our older adults. So it's exciting that this falls on the 50th anniversary of NFID. So thanks for having the discussion. So let's dive into flu. So last year was a moderately severe flu season. We saw about 30 million cases, 14 million doctor visits, 360,000 people hospitalized, and sadly, we lost 21,000 people to flu last season. We know that the folks who are at the highest risk for hospitalization last season were similar to what we've seen in the past. It's older adults who are older than 65, children younger than 5 years. So those are the folks who are at really high risk, over 65 or under 5 years for flu. I also wanted to point out that last season, we saw the third largest number of deaths in children from flu. Up to 174 kids, unfortunately, died of flu. And we know 80% of those children were not fully vaccinated against flu. We know that flu can be serious any season. So we saw moderately severe, as I said, last year. Looking at the Southern Hemisphere, they had a pretty typical flu season, but we need to prepare. And luckily, we have the tools to make sure that we can protect us. And that's what vaccines do. Last season, we saw that the flu vaccine reduced the risk of flu-related hospitalizations among adults nearly in half, and among children nearly by 3/4. So again, hospitalizations reduced in half for adults and 3/4 by children if you got the flu vaccine last year. And then new estimates that the CDC is putting out today show that last season, vaccines prevented more than 66,000 flu hospitalizations. So 66,000 people did not go to the hospital because of flu vaccine. So that's really great. Now, on the other side of the coin, what we saw last year was actually less people getting the recommended flu vaccine than they were pre-pandemic. So we've been seeing those concerning declines, especially in some of those groups that I mentioned that are particularly at higher risk for flu disease. So we saw that there were about 6% less children got the flu vaccine, about 15% less pregnant women, and then healthcare providers who we know, come into contact with sick people clearly during the flu season. 5% less of them got vaccinated. So we are continuing to see gaps in folks getting the recommended vaccinations that we want them to get. And we continue to see these gaps in coverage between rural and urban communities, particularly when we look at kids. And we see persistent disparities in our vaccination coverage among certain race and ethnic groups. Vaccination coverage last year for flu was at about 41% among people with underlying health conditions. So 40% were protected, but that means 60% really weren't. And that's much, lower than we want to see. We want to see as many folks get vaccinated. And the reason is that of the folks who were hospitalized last year from flu, 97% were unvaccinated. So we know that vaccines work, as I said, prevent 66,000 hospitalizations last year. So we really have some work to do to make sure we're talking about vaccines, the fact that they are safe and effective. So that's for flu. Let's turn to COVID. I know it's still top of mind for many. The good news is we're in a very different place than we were just even last year. COVID continues to pose a health threat, but we have more and more tools, and we'll talk about the updated vaccine that we have for that we're recommending for everyone. But if you look at just in 2023, from January to July, so the first half of 2023, most of the folks who are getting hospitalized from COVID, and that continues to happen week over week, they are over the age of 65. So we know that COVID is still impacting those who are over 65 the most. And the others are folks with underlying conditions like obesity, diabetes, asthma, and others. And remember, 70% of American adults have at least one risk factor that increases your risk for more severe illness from COVID. In addition, CDC just put out some data this week that looked at long COVID. These are extended symptoms from COVID. And in 2022, nearly 7% of adults had extended symptoms from COVID, so beyond just an acute phase, and 1% of children. So we are still seeing long COVID. And while we know that COVID does impact kids less than adults, we are still seeing COVID cause serious illness in our kids. And in fact, one of the stats I'll just say for me as a mom of two girls, that half of our young children who are in the ICU with COVID have no underlying conditions. So we're still learning about this disease, but what it's telling me is that kids can get very sick from this, even when they don't have underlying conditions. So all of that data together, the long COVID, the risks to different populations, the extensive safety data led us to this recommendation for the updated COVID vaccine for everyone who's over the age of 6 months. And we know that these are safe. We've given out more than 600 million doses of COVID vaccines. We know that they prevent folks from serious illness, hospitalizations, and death. I look forward to talking more about this and making sure that folks get their updated COVID vaccine. Last, let me just close talking about RSV. Last fall and winter was a tough RSV season and affected tons of families. The RSV season started earlier and increased rapidly across all regions in the country. We know RSV really impacts our infants, really young children, and adults over 60. CDC does estimate as many as 80,000 children younger than 5 years old were hospitalized due to RSV, and as many as 160,000 older adults. So seeing real impact for folks with RSV. And we also saw some tragic loss of life due to the virus, as many as 300 children younger than 5, and as many as 10,000 older adults dying from RSV in a year. So while right now, we are actually already starting to see a rise in RSV cases. They are starting here in the Southeast. I'm in Georgia today, in Atlanta. We're starting to see RSV cases and hospitalizations increase here in the Southeast. And so we'll be watching that closely. But again, the good news here is that we have effective ways to protect ourselves from the worst outcomes of all of these respiratory illnesses. Everyone 6 months and up should be getting their annual flu shot and the updated COVID vaccine. Pregnant women, adults over 60 should be getting the RSV vaccine. Babies should be getting the updated the new immunization for RSV. That should become available in the October timeframe. So look, we have lots of tools, but I'll just close again as a not just a CDC director, but as a mom, as a wife, as a daughter. I wouldn't recommend something for the American people that I wouldn't recommend to my own family. That's why my 9 and 11-year-old daughters are going to be getting their flu shot. They're getting their updated COVID vaccine. My husband's getting vaccinated. I already got my flu vaccine. I plan to get my updated COVID vaccine. My parents, again, getting vaccinated. So I want to encourage everyone to join me in taking the time out of their schedule to protect themselves. It's exciting. We have these tools. We need to use them. So Patsy, back to you. Thanks for having me.
Great. Thank you so much, Dr. Cohen. I too am a mother of 2 girls club member, and they are older than your children at 32 and 30. And I'm a grandma, and those grandkids are definitely vaccinated as well. So we lead by example, right? And thank you for your leadership in this. What I heard you say was so much about we're really talking to everyone. While that U-shaped curve of the very young and the very old may be impacted and are a focus, that is not the only focus. It's really anyone and everyone, those with and without health conditions, any age. So thank you so much for emphasizing that. Okay, Bob, Dr. Hopkins, let's go to you. Could you share some insights into the importance of building vaccine confidence among patients, including parents and pregnant women?
Absolutely. I think as we think about where we stand today, we've got tools that we can use to help protect families, to help individuals to be protected. But if we don't rebuild vaccine confidence, If, as we start this flu season, we're really missing an opportunity to save lives, to save productive work time, to save time for people to spend with the other members of their family. As I think about the challenges we faced in previous years, we know that only about 47% of pregnant women received a flu vaccine during the 22-23 season. That wasn't a big change from the previous seasons during the pandemic, but that's down over 10% from the rates of pregnant women who were vaccinated against flu prior to the pandemic. And that's a particularly important group because we know that pregnant women and women shortly after delivering babies are at high risk for flu. And they're delivering a baby who's also at high risk for flu-related complications. So if you get a vaccine into a pregnant woman, you potentially can save 2 lives and impact more than just one nuclear family. Only 27% of women received a COVID-19 bivalent booster before or during their pregnancy last year. Again, another huge opportunity in a group that is at high risk for severe COVID-19 disease. We need to think about, as healthcare providers, how can we answer the questions and address the concerns of our patients and families in order to build that confidence and significantly increase the number of our patients who are immunized to fully protect all of them, including those pregnant women and their babies. Pregnant women, infants, and young children are at higher risk for serious respiratory disease-related complications, and that can include hospitalization and, unfortunately, death. Changes that happen to the body during pregnancy, specifically in the immune system, heart, and lungs, make it more likely that respiratory disease like flu will cause severe illness during and immediately after pregnancy. Flu infection during pregnancy is associated with increased risk for miscarriage and reduced birth weight for those babies. And pregnant women and those who recently gave birth are more likely to get severely ill with COVID-19. RSV can cause serious illness, particularly in premature infants and those 6 months of younger. And each year in the U.S., RSV leads to more than 2 million outpatient visits, up to 80,000 hospitalizations, and an estimated 100 to 300 deaths among children younger than age 5 years. Can't think of any greater tragedy to a family. Now, for the first time, we have tools available to help protect newborn children from severe illness due to RSV, including a monoclonal antibody that's recommended for infants and a new vaccine recommended for pregnant women. Pregnant women and the parents of young children should talk to their healthcare professionals about RSV vaccination and preventive monoclonal antibodies to help protect infants who are at increased risk for severe RSV-related complications. Our respiratory illnesses that we're talking about, including flu, COVID-19, and RSV, can be serious even for those people who are young and healthy. Everyone 6 months of age and older should get their annual influenza vaccine and an updated COVID-19 vaccine, including our pregnant women. Those who've recently had COVID-19 or had a COVID-19 vaccine are advised to wait about 2 months before receiving the updated vaccine. Healthcare professionals, I would plead with you to advise your pregnant patients to get all of these recommended vaccines. And parents, please encourage your children, even your adult children, I've got 2 of those also, to get vaccinated as recommended. Although the NFID survey revealed that only 38% of U.S. adults would get flu and flu and COVID-19 vaccine at the same time, citing concerns about side effects as the primary reason not to do it, patients get multiple vaccines at the same visit as they may prefer. Patsy, your living evidence. I got my flu vaccine and my COVID-19 vaccine at separate times because of availability, but I'm sure looking forward to getting out and getting my RSV vaccine because I fit into that age group and have risk factors. Remember that vaccine co-administration is safe. There's data to support co-administration of flu and COVID-19 vaccines as well as flu and RSV vaccines. There's more limited data on co-administration of RSV and COVID-19 vaccines. But to close, I want to encourage everyone, including pregnant women, parents of young children, older adults, younger adults, talk to your healthcare professional, answer your questions. Let's get vaccinated, keep our families safe and healthy as we go into the holidays and as we move forward through 2023 into 2024. I'll leave it at that.
Great. Thank you so much, Bob. I really think that your comments about pregnant women especially are just so important. As you know, having been a pregnant woman, you're worried about everything that goes into your body. And so for some people, a vaccine may seem like, oh, that doesn't sound like it would be safe. But your point about flu disease itself increases the risk of miscarriage. So if we want to keep healthy babies and go to term and prevent diseases, the safer thing to do is to get vaccinated, because to go unvaccinated is actually to take a risk. So really good point. Thank you for that. All right. So Dr. Ferdinand, you have a long and amazing career in taking care of all kinds of patients, and your cardiology experience is so important in this particular topic. And your work with your community there in New Orleans is just so great, how you're out with the community. So we want to know, can you tell us more about why those with chronic health conditions, such as heart disease, lung disease, diabetes, are at increased risk for complications from flu and other respiratory diseases?
Thank you very much. That was my clinic call, and I'm a cardiologist. We're always on call. I come at from two angles. So first, let's look at it as a cardiologist. You know, cardiovascular disease, heart disease, stroke is the #1 cause of death and disability in the United States. The same patients that I see as a cardiologist, patients with heart disease, lung disease, diabetes, chronic kidney disease, those are the patients who are also hospitalized and die with the respiratory diseases, including COVID, flu, and RSV. So if you look at persons who have been hospitalized, 9 out of 10 of them have one of these underlying causes. Now, if we focus specifically on the heart, we know that the vasculature is affected by the inflammation associated with these respiratory diseases. And a person who has underlying heart disease within a week of getting severe flu has 6 times the risk of having a heart attack. So I plead with my clinicians who deal with these high-risk patients, often older, but also have these what we call comorbid conditions. It's a condition outside of the respiratory virus itself. Those are the same patients who are going to have more hospitalization and more death. So high-risk patients for cardiovascular disease, lung disease, chronic kidney disease, diabetes, are high risk for death and disability and the cost of hospitalization related to the respiratory viruses, COVID, flu, and RSV. So that's one point. That's as the cardiologist. My other hat that I've had throughout my career has been as a community activist. I believe that the magic 15-minute doctor's visit is just not enough to control the public health. We need to go to the community, faith-based community centers, federally qualified health centers, wherever people are, and try to get them vaccinated. We did this in Louisiana with COVID. In fact, Louisiana was one of the first states in which the disparity, where Black adults were having less vaccination than the general population, we flipped the script by using what we call trusted voices, going out into the community, reaching into the community, and driving people to get vaccinated. As it relates to the flu, we've had Flu NOLA, N-O-L-A, that stands for New Orleans, Louisiana. And we don't just sit back and tell people, go to your doctor and get a shot, because many people don't have a primary care physician. We know that team-based care is not just a physician, but it's also nurse practitioners, advanced clinicians, pharmacists. And in fact, many persons will go to the federally qualified health centers or to their local pharmacy to get their shots. And clearly, that's better than just telling the patient, go to your doctor, and the patient looks at you with a quizzical look. They don't have a doctor. So if you look across the population, the people who have the highest risk are those patients who self-identify as racial ethnic minorities. But then these are the same persons who have lower rates of vaccines. It's called a paradox. Higher risk, but then they have lower uptake of vaccination. So we need to drive those patients to get vaccination. It may not be with a doctor. It's team-based care. It could be a local pharmacist or a federally qualified health center. If you look at persons who have been vaccinated, for instance, in the last year for flu, it was over 50% in those who self-identified as white, but in those who were Black, Hispanic, it was in the low 40s. So there's a disparity there. Again, high risk, but lower rates of vaccination. Now, why is that a problem? Well, we waste healthcare dollars. with these preventable hospitalizations. We, of course, waste lives with these preventable deaths, but it's also a moral issue. We won't have a healthy society until we remove all of these disparities. So we need targeted interventions. Yes, everyone should be vaccinated who is at risk, but specifically in those racial, ethnic populations, socially disadvantaged communities, we need targeted interventions, because if we don't do that, it's a moral issue. Until we remove these disparities related to race, ethnicity, sex, gender, geography, socioeconomic status, then we won't be doing the right thing. So I think that this is something that we should all embrace. Vaccination is one of the best things we can do as clinicians. I, as a cardiologist, the same patients I see who are high risk of cardiovascular disease, patients with lung disease, chronic kidney disease, diabetes, are the same patients who really would benefit from vaccination.
Great. Thank you so much. So inspiring. And your call to action is spot on. We have to flip that paradox, right? Take that high risk, low uptake and make it high risk, high uptake. And we will see a very big difference in the number of hospitalized and deaths in the US. We can do this. We need to do this. And we need to communicate the severity of this, not the false information that often gets communicated. So thank you so much for all that you do for your community and everybody. So Dr. Schaffner, we're going to go to you now. Can you talk about the importance of vaccination for older adults and why we are also focusing on pneumococcal disease? What can we all do to protect ourselves this season?
Well, thank you, Patsy. And yes, I have two quick messages. The first goes out to all of my fellow medical professionals, doctors, nurses, nurse practitioners, and pharmacists. We all know that a firm recommendation from a healthcare practitioner has a powerful impact on persuading people to get vaccinated. So I would urge all of my fellow practitioners to make those recommendations as we go into this vaccination season. And by recommendation, I mean a recommendation with a capital R, not something diffident and casual, such as, Mrs. Smith, it's that time of the year you might consider getting a flu vaccine. That's not a recommendation. The recommendation is, it's that time of the year and you'll receive your flu vaccine on the way out. Let's make it a very committed recommendation. And I emphasize again the entire spectrum of healthcare professionals. Give a shout out to our friends in pharmacy, because they have so many more interactions with patients. Those are all opportunities to recommend vaccination. Now, we've been talking principally about those three bad respiratory viruses, flu, COVID, and RSV. I'm now going to also emphasize that during the winter season, an increase in pneumonia occurs. These pneumonias are often caused by bacterial germs, particularly one called the pneumococcus. It's often the case that a viral infection will precede a pneumococcal infection. It makes it easier for the pneumococcus, that bacteria, to actually create an infection, taking advantage of all the inflammation caused by the viruses, so that pneumococcus comes along. Pneumococcal vaccine is also recommended for everyone age 60 and older, and for those individuals younger than age 60 who have certain underlying conditions. Practitioners, please pay attention to that. Provide pneumococcal vaccine to the appropriate patients, and patients, particularly those of you who have underlying illnesses, ask your provider about pneumococcal vaccine also. Thank you very much, Patsy.
Great. Thank you so much, Bill. And I really appreciate your emphasis and direct message to us healthcare professionals. It really does take all of us. And I mentioned that in last week's ACIP call, that the healthcare professionals are really the linchpin of all of our healthcare delivery of vaccines and antibodies. And if we don't have that strong single message, as you said, with a capital R recommendation, we don't want to say, we'll leave it up to you. Well, a patient needs guidance, and whether it's at a pharmacy or a clinic or out in the community from a trusted school nurse, those recommendations go so far, and it really is an important role. All right, so thank you all, panelists. That was your comments were just excellent. We're going to move now to our media questions. So our NFID Executive Director and CEO, Marla Dalton, will begin sharing the questions we've received from the media. For media participating by teleconference, the operator will come on the line momentarily to advise you how to submit your questions. And again, a reminder that we have Dr. Vivien Dugan from the CDC Influenza Division. She is the director there. She will also be able to answer questions along with our panelists today. So thank you all. And thank you, Dr. Dugan, for being here. So Marla, what have you got so far?
Thank you, Patsy. I think we have more than we'll probably have time to address, but the one that seems to come in from multiple sources is, when is the best time to be vaccinated against flu, RSV, and COVID? Can these 3 vaccines be given at the same time? And the follow-on is, if they're not given at the same time, in what order should they be given, and what is the recommended time to wait between them?
Great question. It is a little more complicated this year, but not impossible. Dr. Cohen, do you want to take that one?
Sure. Well, the first question on when is right now. I think that's why we're having the event. We usually see the start of flu season, and as I already said, we're already seeing an uptick in RSV cases starting now. We know on the COVID side that we have been having an increase in hospitalizations and cases. We had a late summer wave that we do actually see some declines in our hospitalizations in COVID, but we fully expect, based on what we've seen in previous years, that we're going to see an increase in COVID as well. So right now is the right time to be getting folks vaccinated. September and October is that right time. So make a plan to do it. And I would say, yes, get your vaccine at the same time. One appointment, one and done. COVID and flu at the same time. Again, those 2 vaccines are for anyone over the age of 6 months. For RSV, those are for particular populations. If you're over 60, RSV vaccine for you. The maternal vaccine for RSV was just recommended at the end of last week. So that is still starting to ship out and be available. The immunization for babies is going to be available from the manufacturer in October. So those are still ones that are rolling out. But for older adults, the RSV vaccine is available. You can get it now. You can get them all on the same day. Again, it's really your preference in terms of convenience.
Great. Thank you so much. Marla?
Yeah, the next follow-on question comes from Helen Branswell at Stat News, who asks, is the shared clinical decision-making recommendation for RSV vaccine creating obstacles for uptake? And does it have any impact on the requirement of private insurers to cover the cost of vaccine and administration?
So shared clinical decision-making, Dr. Cohen, do you want to describe what that is?
Sure. Well, first, let me say they have to be covered. So the coverage part was easy. On the shared decision making, the way that CDC made the recommendation was to have folks have a conversation with their doctor, their nurse practitioner, their pharmacist about the vaccine. And so we frankly know that happens with most vaccines anyway. So I think this is, in certain places we are seeing that there are certain requirements that are being put on. So for example, here in the state of Georgia, the way they've interpreted that is for you to have a prescription for the vaccine. But that's only in a few places. Most of this is just a conversation so that folks can understand the vaccine, again, because it is newer, that folks wanted, I think, the opportunity for folks to understand that vaccine and talk about it with someone. But frankly, we know that that's what happens across all vaccines. So we encourage folks, again, that's why we're here sharing this information so you can go in with the best information to protect yourself.
Great, thank you.
Okay, I've got a good follow-on from Brenda Goodman at CNN, and I think this one's also for Dr. Cohen. We've heard from older adults who have run into hurdles getting the new RSV vaccine. Their insurance didn't cover it, or they were told they had to get a doctor's note and prescription. What are you hearing about access to the vaccine, and is CDC working to help ease this access barrier?
So as I mentioned, there are certain places that are putting in some rules related to prescriptions and such, but from a coverage perspective, they are all required to be covered. That's an Affordable Care Act requirement of vaccine coverage that needs to become available. And so that's the coverage issue. And yes, there are different ways in which certain states and localities have interpreted that shared decision making. We want folks to, again, be able to talk about this with their physician, but get access to the vaccine as quickly as possible.
Great, thanks. Next question, Marla.
The next one comes from Mark Lalanilla at the New York Post, which is a little bit different. And it says, has there been any research into fear of needles as a source of vaccine hesitancy? People seem to have no problems popping pills.
Well, let's see.
I don't know if I'll let others jump in, other than from my perspective, just to share that I know that manufacturers are working on a nasal preparation, and then others may want to of the COVID vaccine, and others may want to weigh in on other options for delivery of the vaccine for flu and for RSV.
Any needle phobia experts, Dr. Hopkins?
Well, there has been some research looking at needle phobia. It could be a phenomena for children, for adolescents, and for adults also. At present, the needle is the primary mode of administration of most of our vaccines, but there is active research going on looking at nasal formulations of vaccines, looking at patches that you might put on like a simple bandage. So there are some potential advances in the future to come around this. I've done a lot of hand-holding during some of our community COVID and influenza vaccination clinics for folks that are needle phobic. We can get around it. There are some interesting tools that have been used in pediatrics to stimulate the skin around the area where you're vaccinating to minimize some of the discomfort and the fear. So it is a real phenomena, but we can overcome it with supportive conversations with our patients and families.
I used to look at this literature as being the person responsible for vaccinating all of our 7,500 healthcare workers at Children's Minnesota, and older literature, but 6% or so of healthcare professionals have needle phobia and really don't like to get their vaccines. Nobody likes it. But one of the things to know is for children and adults, the psychologist will tell you this is one of the easier things to help people overcome with desensitization. You use a pen that's in the shape of a needle. You do some other like skin type of stimulation. So there are things that we can do to overcome that. But all of those interventions should be comfortable, should be sensitive to their age, should be as pain friendly as possible.
Could I mention also one other thing? At our National Foundation, or at our National Vaccine Advisory Committee meeting last week, we had a presentation from the Autism Association. They've got some really interesting tools and techniques that are freely available for anyone on ways you can get around hesitancy, needle phobia, that kind of thing in a very challenging population. And so I would encourage people to look at some of those tools.
Right. Great. Yeah, we had a nice low light comfort room for people who needed it. So think ahead for what the population needs. Okay, next question, Marla.
Okay, the next question comes from Jillian Wilson at Huffington Post that talks about, anecdotally, we're hearing a lot of reports of people feeling more side effects from these new COVID boosters compared to previous ones. Of course, we want to encourage people to get their vaccines. Is there a theory why this might be happening to some people? And do you have any guidance that we can share on how people can prepare and alleviate it?
Dr. Cohen, what are you hearing?
Sure. Thanks for the question. Was that specific, to the updated COVID vaccine?
Yes.
Correct.
Okay, thank you. So one, I would say we have not been hearing that. That is the first I am hearing. So remember, anecdote is not data. So that's why we make sure that we are collecting good information about what's happening for folks. What we have heard is the most common side effects are pain at the injection site, and maybe some malaise afterwards. Folks were taking some Tylenol or Advil, and within 24 hours feeling better again. Obviously, we'll continue to watch this closely, but that is not anything that we have heard.
Right. And yeah, go ahead, Dr. Ferdinand.
Yeah, not specifically related to the COVID vaccine, but for the older folks who are getting the high dose of the influenza vaccine, they may have more of a reaction than they had experienced in the past. And again, we just tell people that it's not going to be anything that's harmful. It's not the flu. It's something that shows your immune system is being activated, and perhaps get it on a Friday or get it on the weekend if you're working, and expect that maybe you're going to slow down a little bit the next day or take some sort of medications over the counter for the discomfort.
Great.
Treating those symptoms is the right thing to do. If your health situation allows it, taking some acetaminophen or a ibuprofen or naproxen over the counter, but make sure you communicate with your healthcare provider.
Right. And we learned through the initial COVID vaccines and the wonderful VSafe program that the majority of people who got COVID vaccine really had, no adverse side effects. The majority of people did quite fine, but you should expect that you may have that arm soreness, some malaise, some fatigue. And when it happens, thank your immune system, because as Dr. Ferdinand said, that's what's happening. And it's actually not a bad sign. It's a good sign. And Dr. Cohen, is VSafe going to be available going forward?
Yes, ma'am. So we are continuing to make sure that we are monitoring and tracking any adverse things related to the vaccine, and we will continue to do that.
It was a fantastic tool, real-time information of people getting vaccinated that we can all track. It's wonderful. Okay, Marla, next question.
Okay, a lot coming in around supply and availability. The next one is from Alexander Tin at CBS, who asks, why has it been harder for parents of young children to find COVID vaccines?
Dr. Cohen, young children's supply availability question?
And this is again just for the COVID vaccine, or is it? I apologize.
Correct. It's specific to COVID here. Sorry.
Yeah. So as you know, we're about 2 weeks into having the new updated COVID vaccine, and it is a different process this year. So previous years, this was the vaccine was purchased by the federal government and then distributed by one entity. Now we're sort of going back to what I'd call the normal course of business. The same way that flu vaccines are distributed is the way these new updated COVID vaccines. So it means that individual providers need to order them, the manufacturers and distributors need to ship them, and in ordering them, they purchase those vaccines. So again, it's just a different process than we've done in the last couple of years. We do know that our manufacturers and distributors were getting out the adult vaccines first. So that was what was shipping in the first number of days. And now they are shipping pediatric vaccine. We know pediatric vaccine has shipped. We are seeing that shipped particularly to our Vaccine for Children program sites. Those are the sites where children and their families can get free COVID vaccines through that program. So we know that it's shipping. We know that they were shipping adult vaccine first and now pediatric vaccine. So what I would say is that the supply is filling out, and make sure that you're calling ahead to your pediatrician or your local pharmacy to see if the vaccine is available. And if not, check back again.
I have a good follow-on question. Sorry,
Patsy,
good follow-on question to that for Dr. Cohen as well. And it's referencing the Bridge program. So can you describe the Bridge program and discuss, is it up and running for the new COVID vaccines, and if it's not, can you give an update on the status?
Sure. So to take a step back again, because this process for getting your COVID-19 vaccine is different. Before, the federal government was purchasing and it was free for everyone in sort of a simple way. The good news is it continues to be free, but the process is slightly different. So it is either free because your insurance covers it completely, and that's great, and most insurance do. But if you are either uninsured or your insurance doesn't cover it completely, maybe you went to a pharmacy that's out of network, you can get the vaccine for free through the CDC's program called the Bridge program. This program is running at a number of sites where you can get a free vaccine. It is running at CVS, at Walgreens, at our public health departments, at federally qualified health centers. You can see some of those Bridge access sites through vaccines.gov. And so that's how you can access a free vaccine. And again, so either free through your insurance or free through this Bridge program, but there are Bridge program sites. That's not going to be free everywhere, but if you go to a CVS, a Walgreens, some of our other pharmacy partners, as well as health departments and FQHCs. And a reminder, we do have a universal vaccine for children's program that covers not just the COVID vaccine for free, but the flu vaccine, the RSV vaccine, and others.
Great. Wonderful. Marla, do we have time for any more questions?
Yeah, I think we have time for one more, and there seem to be a number around safety. So we'll close with the safety question, which is, how do we know that these vaccines are safe for older adults? And the questions were specific to the new RSV vaccines as well as the specially formulated flu vaccines.
Bill, do you want to start with vaccine safety?
Sure. I'm happy to emphasize something that many the average person frequently doesn't realize. The United States has a continuing vaccine safety program that oversees the safety of all the vaccines that we use. And the data are constantly being accrued, evaluated, and reported out to the CDC's Advisory Committee on Immunization Practices. And apropos of the new RSV vaccines in particular, the clinical trials that were done, it is a new vaccine. We don't still have the experience of having administered hundreds of thousands or millions of doses, but the data from the clinical trials are very reassuring. There were two little signals that came up that we should recognize. The first is there were several cases of a neuroinflammatory disorder, Guillain-Barré-like syndrome. They were thought by both the FDA's advisory committee and the CDC's advisory committee to likely have been coincidental. We're going to keep an eye on that going forward in particular. And there was also a hint, even less impressive, that there might be a predisposition to atrial fibrillation. That also was thought to be unlikely. Obviously, we were giving this vaccine in the clinical trials to older persons, and older persons are more apt to have atrial fibrillation. I can tell you about that. It is, I think, also unlikely to be a stimulus for that, but that also is being looked at. So this National Vaccine Adverse Event Safety Program that is multifaceted, it's the best in the world. No other country has one that's as comprehensive and continuous as ours.
Great, thank you. And Dr. Cohen, anything you want to say about safety?
Well, one thing I just wanted to correct when I said about the VSafe program, we are relaunching that. So I just stay tuned. So in the next couple day to week, we'll be relaunching the VSafe program. So that's one about tracking safety. But as we look at all of these vaccines, it goes through an extensive review process, independently reviewed both by the FDA and the CDC. Thank you to the experts that you are hearing from beyond the CDC that we get to advise us before we make those decisions. We look at that safety data very carefully before we make these recommendations. And I'll just go back to, again, more than just as a CDC director, as a mom and a daughter, these are vaccines that I recommend for my own family in terms of safety. So we encourage you, I think it's good questions to ask, have that conversation with your doctor, with your nurse practitioner about this. But again, see that these vaccines are very safe. And what is actually risky and what we've been talking about is not getting vaccinated, right? You have to understand it in comparison to the risk of not getting vaccinated. We were talking about that with pregnant moms, how the risk of getting flu can be risky to your pregnancy. So not getting vaccinated is a higher risk. So making sure that we're not just looking at the safety profile of the vaccine, very important, but what is that risk of not getting vaccinated as well? I think that's important for folks when they're asking questions of their doctor and their nurse practitioner. Make sure you're talking through both sides of the coin.
Right. Thank you so much. To do nothing is to take a risk, right?
Yeah.
So I think we need to close out here. These panelists have been fantastic, but I want to encourage you all to show your support for vaccination by joining the NFID Leading by Example initiative. Share your vaccination photos on social media using the hashtag #GetVaccinated, Fight Flu, and Prevent RSV, and be sure to tag NFID. And remember to take 3 steps to help protect yourself, your loved ones, and your community from illness this fall and winter. Number 1, get vaccinated. Number 2, help stop the spread of infectious diseases with healthy habits like washing your hands. It's not just for kindergartners. We all need to do that. Stay home when you're sick. Please stay home when you're sick. Cover your cough and sneeze, wear a mask if you or a household member are at risk. We all need to look at the ventilation in our schools and homes and businesses. Number 3, if you do become ill, treat with medication if prescribed by the healthcare professional and take it as directed. So take 3, get vaccinated, do all those healthy habits, and if you do become ill, take the medication as prescribed. So thank you. This news conference is sponsored by NFID in collaboration with the CDC, and a special thanks to our partners and the funders who make this activity possible, including GSK, Merck & Company, Pfizer Incorporated, Sanofi Pasteur, and Seqirus. Note that the NFID policies prohibit funders from controlling program content, so they have had 0 involvement in what we did today. So thank you to our panelists, our partners, and to the media participating for all you do to help raise the awareness and education for the public about the importance of vaccination. Your partnership is essential to protecting the public's health. So a video of today's news conference and additional resources will be available on the NFID website, and that website is full of helpful tools for all kinds of people. So go to www.nfid.org, and then for this, you can go /2023 flu news. Thank you all so much, and go get vaccinated.